Our setting is a group of new hire labor and delivery nurses at Mitchell Community Hospital who are participating in a protocol review with their orientation nurse supervisor. Listed in front of you are the 3 learning objectives that the new hire new grad nurses should complete by the end of the protocol review session. These objectives include: number 1, the new hires can identify the 4 T's that place postpartum mothers at a higher risk for hemorrhage by the end of the protocol review. Number 2, the new hires will demonstrate knowledge of clot sizes that indicate postpartum hemorrhage by the end of the protocol review. And number 3, the nurses will verbalize 3 interventions for postpartum hemorrhage by the end of the protocol review.
Okay. Hello, everyone. Welcome to our facility. We're so happy that you guys are here on our unit. I bet you're excited, just graduated nursing school, ready to help some mamas deliver some babies, right?
Yes, ma'am.
So today, though, we're going to go over a more serious topic. It's postpartum hemorrhage and kind of what we do here at our facility as the nurse. So first of all, we're going to kind of talk about what postpartum hemorrhage is. And so we have a few things, some fun things set out to help us go over this. So over here we have our 500 mLs of blood. And so if a mom is losing this much blood or more, she is technically having a postpartum hemorrhage from a vaginal delivery. Now here are 1,000 mLs of blood is going to be what our postpartum hemorrhage will be considered for our cesarean sections. If they're bleeding more than that, then that is too much and we will intervene. And the reason that postpartum hemorrhage is so prevalent is because during pregnancy, when the moms are growing the baby, their cardiac output increases by 50%. And then during the pushing and the delivery, it increases by 80%. So the cardiovascular system is just so overworked. And then when the baby is out, it has to just go back to normal. And sometimes it just doesn't happen. And that's why we have the postpartum hemorrhage. So now that we've kind of gone over what postpartum hemorrhage is, let's talk about some of the risk factors that put our moms at risk for postpartum hemorrhage besides delivery. And we usually use the 4 T's to talk about that. The first T is going to be tone, and that refers to the tone of the uterus. So you really want the uterus to be firm, you don't want it boggy. So up here I have a couple of examples of what you're feeling for the uterus whenever you're doing your assessment after delivery. So we want the firm and not really the boggy. So if you will, just kind of press on each of these. Tell me which one you think you would want to feel for.
Well, if the uterus is supposed to be contracted, it would be firm.
Yes.
Okay.
Yep, and that's the firm one, so that's perfect. This is the one that we're going to feel for. Great job. So let's move on to our second T, and our second T is going to be our trauma. And trauma refers to any tearing when the mom delivers vaginally, or even with a cesarean, they're having an incision, so that's a cut. But with any tearing, lacerations, that can be risk for more bleeding as well. And then our third T is going to be the tissue, and that means the retaining of the placenta is going to put mom at a higher risk for postpartum hemorrhage, because if they're retaining any tissue, then it's going to be harder for the uterus to contract back down, because there's still something in there that needs to come out. So that brings us to our fourth T, which is thrombin, and that means like a low platelet count. Because if the mom has a low platelet count, then they're not having any coagulation, so nothing is clotting, everything's just bleeding out, postpartum hemorrhage. So that kind of covers some of those risk factors. Do you remember what are the 4 T's? If you can just reiterate those back to me, what the 4 T's are.
Okay. Thrombin, related to platelet count. Trauma, related to tears and basically just any injury to the birth area.
tissue relating to retained placenta.
Yeah.
And what is that fourth one? Tone.
Yes.
So you want your uterus to be firm, but not boggy.
Yes, perfect. Those are the 4 T's, the risk factors for postpartum hemorrhage.
Awesome.
So now let's move on to some signs and some symptoms that can kind of point you in the direction of knowing, hey, this mom is having postpartum hemorrhage.
Okay.
And one of those that's kind of an easy sign that you can see clearly is going to be the lochia that is present on the pads after birth. So I have some pads set out here that you can just kind of look at while I'm going over this. So for clots for mom after birth, some clotting is normal. We say, you know, golf ball size or smaller. Anything really that's in size of an egg or larger is not a good size clot. Something's going on, we need to assess further. And then as far as the amount of blood, like I said, you know, we have the 500 and the 1000, but if you're looking at a pad, if they're bleeding through one pad in an hour or less, that is too much. We want to definitely assess further. So based off of these pads that I have out here, which one do you think is not good that we want to assess further?
Well, these two are my main focus. This one gives me infection vibes, but this one, these clots are definitely golf ball size or larger, so
Right.
I'm gonna choose that one.
Right, that is definitely the right answer.
Okay.
And which, so making that the bad one, which one is, you know, if this is a good amount of blood, I'm okay with this. And that is correct, it would be that pad.
Cool, so some clots present, but not huge.
Right, and you know, a scant or small amount of blood is great.
Okay.
And then some other kind of symptoms you want to look out for are going to be those symptoms of blood loss that you would see in anybody. So any dizziness reported by mom or lightheadedness, she's tachycardic or she's hypotensive, those are usually pretty good signs that there's bleeding out somewhere.
Okay.
Yeah. So now that we have these signs and symptoms of mom, she's bleeding a lot, she's, you know, tachycardic, hypotensive, we're gonna kind of set in some interventions now. And at our facility, we have kind of 3 specific ones that I'm gonna go over. We do have a policy, so if you ever just don't know which ones to do or you forget, because there's a lot to remember, here's our policy. And I can give you a copy of that, but you can also find it on the website under policies and procedures. So, first thing we're going to do is, let's say we're assessing mom after birth and you feel this uterus, it's boggy and you're like, that's not okay. What you can do is do uterine massage. So you're just going to press down firmly on that uterus, massage it, and just see if by massaging it you can firm it up. And you want to do that every 15 minutes for a whole hour until it gets firm. And then if it doesn't firm up by that point, you'll do it more often. And those specific parameters are in the policy that you can look. And then we're going to administer oxytocin IV. Typically there is a bolus dose given in LR, and then you will give a maintenance dose. And the doctor will have specific rates for those that they like to follow. They have different preferences, so we usually go by what they say. And then after that, there's something that we do at our facility. We always want to have our postpartum hemorrhage cart ready and handy. So we don't want to keep it in the room because it's kind of scary. You know, mom's like, what is this? Why is this in here? I'm not, you know, you don't want to scare mom that if nothing's going on. But we do, especially if she's at higher risk, we want to keep it outside of the room and definitely make sure it's fully stocked. So that way, if something starts going down, we just go and grab it, bring it right in, so that we have the supplies that we need. So yeah, so just to kind of go back over, what are those other signs and symptoms that we're going to look out for besides the pads if mom bleeding?
So we are going to feel her fundus of the uterus, and we are going to assess if she's having a hemorrhage, that it will be boggy, it won't be firm. And then we'll look at her platelet. She might have low platelet count. And then we'll take her vitals and check her blood pressure, see if she's hypotensive.
Right.
We'll check her.
Yeah, she's hypotensive, and then what are we gonna look for in her heart rate to see if she's having blood loss?
So I think that her heart rate will try to compensate for the low blood pressure, so it will elevate.
Yes.
Okay.
Perfect.
Cool.
That's great. And then with all that blood loss going on, what might mom be feeling?
She might get like dizzy, feeling fainting,
Yes.
weak.
Perfect. Yes. That's awesome. And then as far as the interventions that we're gonna do you remember those 3 that we discussed for the interventions?
So I do remember you saying that we would give an IV bolus of Pitocin or oxytocin, and that would be an LR, correct?
Yes, typically.
Okay, and so that would help bring the blood pressure back up, and then we would massage the fundus, the bolus. So we would massage the fundus. And try to get that uterus to contract. The oxytocin is also to help with the contraction as well.
Yes.
And what was the third one again?
So the third one is going to be the cart.
Okay. And always keep the cart close.
Yes, keep it
Okay.
close.
Cart close.
Yeah.
Massage the fundus. Pitocin, oxytocin, to help with the uterus contracting.
Yes.
Contracting means basically a tourniquet then.
Yeah, kind of clamping back down.
Okay.
Yeah. Okay. Is there any other questions that you have? You retain the information very well.
Thank you.
Okay.
I don't have any questions. This was an awesome setup.
Perfect. Yep, we got our blood loss here. A nice picture of our uterus here, just showing kind of the blood pooling in and what's going on here with that as well.
That's awesome.
Yeah.
Thank you so much.
You're welcome. Thanks for coming to my presentation.
The following slides provide an up-close view at the education material used throughout the protocol review. The first pad is an example of normal lochia. It contains a scant amount of blood with normal-sized blood clots. The second or middle pad is an example of abnormal lochia. It is indicative of a potential infection, such as retained placenta. It shows moderate blood with some green and yellow discharge. The third pad is an example of an abnormal lochia. It contains an abnormal amount of blood and several large clots. This pad is indicative of a postpartum hemorrhage. These are 2 examples of a postpartum fundus. The model on the left is an example of a boggy fundus, and the model on the right is an example of a firm fundus.